Welcome back to the Miracle Moment. My name is JJ. I am your host, and we have once again with us Dr. Kenneth Orbeck. Hello, sir. How are you?
Well, JJ, how are you doing today?
I'm actually so excited to talk more about testosterone. Who knew?
I know, right?
Right? Yes. Yes. Such eye-opening insight that you provided to all of us last podcast. So let's pick back up where we left off and talk a bit about how do we replace testosterone safely?
Oh, that's a great question. There are many forms of testosterone replacement therapy delivery systems, and we need to go through those today. I just want to educate everybody out there on how it can be given and what I think is the most effective way. So let's talk about how we can normalize testosterone safely and effectively right now by talking about the various application forms. The first would be topical testosterone. That would either be compounded or commercial, gels or creams. The second would be injections, where you actually inject the testosterone into your body, yourself. The third would be patches, where you apply the patch to the skin. And the fourth would be sublingual. You can actually use a testosterone troche and put it sublingually. And then the fifth would be pellet implantation. That happens to be my favorite, and I'll explain why, as we get through this, why I feel like that is the most physiologic way to replace testosterone. All right, so let's first of all get into transdermal testosterone. Commercial gels are available. Some of the names may be like Testim or Androgel. And let's talk about some of the advantages and disadvantages of these gels, okay? The advantages is that the gel's well absorbed, all right? It may be more easily covered by insurance, so it'll be cost effective. Single-use tubes or packets or pumps are usually given, and it's available from all pharmacies, so it's easy to get. Disadvantages. It can have a strong alcohol odor, and there's fixed dosages, so you can't always customize. It's very costly if it's not covered by insurance, by the way. Limited to only one type of vehicle delivery. So if you have a problem with a gel or an allergy or a skin rash, then that's an issue. And one thing I don't like is you get more dihydrotestosterone conversion. Testosterone will convert to DHT. It's done through an enzyme called 5-alpha reductase. That lives in the skin. And so when you put testosterone on the skin, that conversion can occur. And that will give you more side effects of testosterone replacement therapy. So we've covered basically transdermal testosterone as far as commercial products. What about compounded testosterone? Everybody has heard about compounding pharmacies, right?
Yes.
And so let's talk about transdermal testosterone through compounding creams or gels. The advantages, again, well absorbed. Dosage is now customizable, so you can really clearly change the doses as you need. There's multiple delivery forms. We have pumps, we have Topiclix, we have syringes. It may or may not be covered by insurance. It depends on your insurance company. And multiple vehicles, if an allergy is a problem, then that's going to be a problem as well, okay? Disadvantages, they're thicker than commercial gels. So you may have a problem applying it that way. There's a lack of large multi-centered studies on the compounded pharmacy products. It's available from compounding pharmacies, and it's not available from standard pharmacies. You do have to go through a compounder, and it may take more time. And the disadvantage is also, again, it's a gel or a cream, you're going to get DHT conversion. Okay?
Which we discussed is not what we want.
It's not what we want. So, we talked about the, transdermal form of delivery system. Now let's talk about injectable testosterone, okay? This is very commonly used. We'll talk about the advantages and disadvantages of this. So the advantages of injectable testosterone is, yes, it's very inexpensive, okay? Dosage is easy to adjust. You just have to adjust it on the syringe, and the bottle can last for several months, okay? Some of the disadvantages and discomfort. It hurts. And you get more frequent conversion to DHT and to estradiol, okay, E2, when you inject. You can have local muscle reactions from repeated injections. You can have scarring, lipomas, pain, and you can get fluctuating testosterone levels. I call it ebbing and flowing. So you get peaks and valleys when you inject. You're putting the hormone into the body. Whether the body needs the hormone or doesn't need the hormone, there it is. I injected it. Higher levels occur, and it will peak and trough, okay? So That's the basically the advantages and disadvantages of injectable testosterone. Inherent problem with either injectable or transdermal testosterone is that you get constant high levels of testosterone in a non-physiologic peak and trough, even at rest and during sleep. Okay? That's not something we want. We want to always stick to physiology and replacing the hormone the way it used to be replaced when we had our testicles and our ovaries, right? Simulating the body's natural response. So constantly high levels of this testosterone is not physiologic, okay? It increases the risk of aromatization. Well, what is that? Aromatization basically means that testosterone will be converted to estrogen. That's what aromatization means. It can also be converted to excessive dihydrotestosterone, DHT. We already talked about that, okay? Injectable testosterone may have some adverse reactions as well, okay? So that's basically injectable testosterone, and now I want to talk to you about what I call subcutaneous sustained-release delivery system. It's often called pellet therapy. It's commonly what I use in my practice, and I find that this works very effectively. So subcutaneous hormones have been actually used since 1938. You know, people think that this is a new entity, and we just started using this. It's not. It's been proven. It's been proven over a long time, and it's been a very effective way to replace the hormone. Clinical trials show a therapeutic effect once you put subcutaneous pellets in a person within 24 to 72 hours, okay? Most people feel a difference within 24 to 48 hours. Others may take up as much as maybe 4 to 5 days. And that's because the testosterone, when it's put in the body, it has to cross the cell membrane, go into the cytoplasm of the cell, cross the nuclear membrane, go into the nucleus, and attach to the DNA where it promotes its excitation on the DNA, instructs the DNA on how to make protein. Okay?
This is the communication, basically, that we're creating. Okay.
And that takes time, okay? So sustained release pellet therapy deliver constant physiologic levels of hormones, all right? The pellets avoid the fluctuation of the hormone level seen with every other method of delivery, all right? It's consistency in delivery that makes them so effective. And I often talk to my patients like this. I say, if I put this little small entity in your body, which is bioidentical now. This is the only way, by the way, to get bioidentical testosterone is through pellet therapy, okay? So when we put the pellet in the body, it's surrounded by a capillary bed because we put it into the fat. Surrounded by a capillary bed, the blood through that capillary bed will pull that hormone off of that cylindrical pellet based on the blood flow. Well, that blood flow is based on heart rate. Now, heart rate is based on what? Your circadian rhythm. It's based on whether you exercise, don't exercise, and your activity level. Okay, so now we have more of a physiologic effect of getting the testosterone into the body. More activity, more hormone. Circadian rhythm is respected, okay? So it offers you a delivery system that is more physiologic. That's why I prefer this method of delivery, okay? So it's the consistency that makes them so effective. And delivery is nearly identical to the hormone delivery if you look at when it was delivered from the testicles to the ovaries. So it's the most physiologic way that you're going to actually, be able to achieve hormonal optimization, okay? The issues of subcutaneous sustained release therapy is it does take training. It's not something you can just see a person do it and do it. So it involves more technical skill, and it also requires a very good pharmacist to make this product. It should be made almost in a commercial fashion with sterilized presses that are run by computers properly and gives you pellets that are very consistent. So in order for you to get a very effective response, you need a properly formulated pellet that's made with exact science. You need a provider that is well trained and knows how to put them in properly because it does take training and skill to be able to do this. And then you need a patient that's compliant, meaning that once you put the pellet in the patient, they don't run off and go to the gym within 24 hours. With the way we're doing pellets in my practice now, a patient can work out within 2 to 3 days. It's very easy, all right? And our local reaction rate is extremely low, less than 0.1%, even less than that. So we're having good results and seeing good effects of subcutaneous sustained release therapy, all right? So that's the basic ways of replacing testosterone therapy in the body. And I vary between the different entities depending on what the patient's desires, needs, and goals are. My preferred rate is with subcutaneous sustained release therapy. I have better control of the hormonal delivery system that way, and I get a better effective response at the end.
Where would a client suspect that this pellet would then be inserted? What's the process for that, as an example, when they come into your office?
When or where?
Where? Well, on their body. Like, how does that actually look for the overall experience for your client?
So in the in a woman, typically I do the upper outer supragluteal area. It's the upper hip. It's a fatty area. And if I drew out the anatomy, I could show you exactly how we palpate that from the iliac crest down posteriorly. And where we put that pellet is very important because it's called a safe zone. You know, it's lacking deep vessels and nerves and things so you don't have any type of injury. Putting it in there is very safe, very effective. In men, what I've been finding is that I'm doing more now in the sort of love handle region. So I also do it in the upper outer gluteal region in men, but I'm finding that in the flank where you have that love handle, I get very good insertions there, very little downtime. Basically, the men can't even tell they even receive pellets, which is a great thing. And then they get all the benefits for the next 90 to 120 days as it releases. And so it's very convenient as well.
So that was going to be my next question, which is how long between inserts do you have to go? So it's about 3 months or so, 3 to 4 months?
Usually 90 to 120 days, depending on the patient's metabolism and activity. A lot of physicians will extend it beyond that. I don't like to get into the trough area. I like to replace the pellet. I like to replace the pellet at the time when the other pellets are wearing down, so you get a little overlapping effect, and that way you get more linearity of the hormonal release over time. Is very effective, and they don't have the fall off.
Yes, so it's smoother. It's a smoother transition. Mm-hmm. And once your patient comes back in for that second round, are you doing another round of testing to find out how it's affecting their body?
Absolutely. So we do initial testing, customization of hormone replacement therapy, and then we do a follow-up with testing in anywhere between 8 and 12 weeks. I'll do testing and have the patient follow up with me in either 3 or 4 months, depending on what I instruct that patient to do. So I'll test the hormones right around usually 8 to 10 weeks because I want to see kind of where the peak is, and then we'll move forward and decide what kind of dosing we'll continue in that case.
Okay, great. Thank you so much for sharing that. Now, you probably have listeners that are not necessarily located in Greenville, South Carolina. So for those listeners that maybe can't get to you to learn more about it, what are some questions they should be asking to find out about therapies that are similar that can help them?
Find a physician that has qualifications in bioidentical hormone replacement therapy. Certifications like American Academy of Anti-Aging Medicine, or Functional Medical Institute, or different things out there that are available to train these doctors about not only hormone replacement therapy, but the delivery systems as well. If you're going to entertain thoughts of subcutaneous sustained release therapy, make sure that physician is well trained, that they have experience behind their belt. I have thousands and thousands of procedures behind my belt. I think I've done probably over 30,000 insertions. And so to me, it's very simple and easy. But to someone who's done their first or second one, they need guidance and training. I don't think I would simply watch a video and do this type of therapy. I think you need some guidance and training. And once you have that, and then you have a history of utilizing that delivery system, I think that would be admirable. So you need to look for a physician that is like boarded in age management medicine, integrative medicine, and well-versed in hormonal replacement therapy with both experience and also has affiliation with pharmacies, compounding pharmacies that have the quality and excellence required to compound these therapies.
Thank you again, Dr. Orbeck, for sharing that great insight on testosterone. We appreciate you listening to The Miracle Moment. We look forward to seeing you all again soon.